Okay, I don't know how long or how short I can make this video. I'm gonna try to make it small, but it's the spectrum about it is so large that I may have to make it in two, maybe three parts. So it's not a lot of information at one time. If you've been following me for any amount of time, then you are well aware that I am 1 in 4 that suffers from endometriosis. And I have endometriosis, I have fibroids, I have adenomyosis, I have, is that it? All of the things, like it's a whole cocktail. And I was first diagnosed in 2003 after I had my oldest. And there is probably evidence that I had it before that, because the things that are considered to be high risk. So if you have a family history of endometriosis, if you start your cycle early, if you're black, let me just say that, let me see if I can define endometriosis for you, because what it says is that endometriosis was considered rare in black women. It's only diagnosed 100% through laparoscopic surgery, and it takes on average 10 years to be diagnosed. And most of the time when you're having signs and symptoms, of course, they tell you that you have PID, pelvic inflammatory disease. You just have a bad cycle. Not every woman's body is different. So what you're experiencing is not the same as your homegirl that was diagnosed with endometriosis. I've had endometriosis probably 19 years. Well, maybe 20. It'll be 20 this year. And I have a friend that just found out she had it last year. But her symptoms were the same as mine, with the heavy bleeding, because that is some of the symptoms of endometriosis: heavy bleeding, painful sex, constipation, pain with urating. Infertility is also a sign of endometriosis too. So endometriosis is defined as a chronic condition that has reproductive and health consequences. A greater number of black women are affected by endometriosis. The Endometriosis Association suggests that endometriosis, which is symptomatically characterized, listen here, by pelvic pain, infertility, abnormal vaginal bleeding, and has been misdiagnosed in black women as pelvic inflammatory disease, a sexually transmitted disease. Endometriosis is the abnormal growth of cells, endometrial cells, similar to those that form the inside of the uterus, but in a location outside of the uterus. Endometrial cells are cells that are shed each month during menstruation. In endometriosis, endometrial cells attach themselves to tissue outside the uterus. The uterus and are called endometriosis implants. These implants are commonly found on the ovaries, fallopian tube, outer surfaces of the uterus or intestines, and the surface lining of the pelvic cavity. They can also be found in the vagina, the cervix, the bladder, although less commonly other locations in the pelvis. Endometriosis is most likely to affect you or if you are in your reproductive years. Most cases of endometriosis are diagnosed between 25 and 35 years old. However, endometriosis has been reported in girls as young as 11. Mind you, I didn't get diagnosed until I was 21, And I suspected, because I started my cycle at 11, that I probably started at 11. There is a lot of stigma around endometriosis. For a long time, it was like I was wearing the scarlet letter. I was afraid to even admit that something that was out of my control, that I even had endometriosis. And I felt like the lady in the Bible, the woman in the Bible with the issue of blood. And I'm one of those, I do all my research. So I've tried, the first thing that they tell you to do is try birth control. So I tried birth control, I tried the shot, I tried Lupron injection. The Lupron sends you through chemically medicated menopause. That shit was not a joke. Baby, them hot flashes hit you and you heat up from your head down to your body. I was in the wintertime sitting in the office with a fan on. I was fanning myself. I couldn't get cool. And then just like that, it would disappear. Terrible side effects with that. I've had doctors tell me that they don't understand how I was able to carry not just 3 to term, but 1. They don't understand how I was able to carry my kids. They're miracle kids, by the way. But a lot of times you may not even know you have endometriosis. So how my friend found out is she had a flare-up, which a flare-up, I've known that I've had those, didn't actually know what to call them until recently. But you get these maybe something ruptures, maybe a cyst ruptures, maybe a fibroid presses on something too much, or maybe some endometriosis grows on a part of your body that irritates you so much that it swells up and you're bloated and it hurts to move, to walk, to pee, to think, to chew. Like this is the type of pain that the endometriosis causes. And it affects your mental. A lot of times you can't understand why your body hates you, why your body that is supposed to be just like other female bodies don't really cooperate with you the way theirs work. You're fatigued, you're tired, physically you hurt because migraines come along with it, leg pains come along with it, back pains, body aches, fevers. Like there's so many different symptoms that all together make it miserable just to exist. There's also a condition called painful bladder system interstitial cystitis, which is like a sister to endometriosis, which has also to be sometimes diagnosed by them just going in looking at it. But it causes your bladder to hurt and you to have bladder spasms on top of periods that ibuprofen and Tylenol does nothing for. Narcotics does nothing for it. Before I knew what I know now, sometimes when I would have a big flare up, I wouldn't go or wouldn't think much of it until it got to the point where I could barely move. And then I would go to the hospital trying to get answers, only to be looked at as a drug seeker, to be given morphine and then sent home to have a reaction to the morphine. So now I have gone to the point where I've changed what I eat, I changed what I do. If my body is telling me to rest, I will rest. But it's one of those things that not a lot of people talk about because it's a woman's disease. Men can't get endometriosis, although I wish they could, and then maybe they would try to cure it. Figure that. And hysterectomy does not cure this shit. They don't tell you that, because what they haven't said and what they're just now saying is that endometriosis, although they said is rare, and from my understanding it is rare, but hey, if it's rare, your girl got it. Endometriosis can grow in the brain. It can grow in the chest, on the diaphragm. It can cause your lungs to collapse. And it can also cause, it's funny, times when I wasn't pregnant, my stomach would be bloating during the time that I was full of cysts and endometriosis and fibroids, and you look pregnant. So at the times when I wasn't pregnant, or the times that I was pregnant and then had a miscarriage that nobody knew about, they would ask, are you pregnant? Oh, you're pregnant. Congratulations, you're pregnant. And wasn't pregnant. And the time that I was pregnant, I didn't look pregnant. And people didn't even know I was pregnant until I was like 7 or 8 months alone. So that is where it affects you mentally, because you're like, I want a baby, or I would like to be pregnant, or I don't want to be pregnant, and I don't want to look like I'm pregnant, and people are asking me, and that causes stress and anxiety, and it causes your body to kind of go out of whack even more. And then you have the birth control pills, which are designed to make the body think that it's pregnant to keep you from getting pregnant, but you have all these other things going on with your body, and depending on your body type, your blood type, certain medications don't mix. It's so vast that there's a couple of specialists around the world that I feel like are tuned into it and try to figure out what's going on with the female body. And there's so many other doctors that just want your money. So they'll tell you, let me take your uterus out. You keep your ovaries so that I don't have to put you on hormone replacements and you'll be fine. Absolutely not true. It is not true. And then some of the doctors are not endometriosis specialists, so they're not really trained to exercise it, so they ablate it. Ablating is just burning it, and what does it do? It grows back. And then when it grows back fiercely and angry. I would say how, this is my interpretation. You have an angry snake and you cut his tail off, and what do they say about snakes? They just regrow. But when he regrow, he ain't forget that somebody cut his tail off. So now he's angrier, he's bigger, he's badder than he was before. I think and they say that these kind of things feed off of emotions and stress. Stress can cause your body to go all out of whack, especially when you're Black and you have so much stress, and then doctors are telling you it's in your mind, or it's just a bad period, and then you start to think, is it in my mind? Am I making it up? Like, all of these things contribute to making the condition worse. Mind you, it takes 10 years on average to be diagnosed with it. Is not recognized as a disability. However, I did see that they rated it in the, I want to say top 10 of the most painful conditions. Let me see. I think it's there's different stages of it, and let's see. It doesn't just come with your period. So that's another thing that they won't tell you. They'll say, oh, your period's just 5 to 7 days. Wrong. Because you have a premenstrual cycle, you have your cycle, and then you have your post. Baby, that's half of the month right there. That's at least 3 weeks, depending on how long you bleed. I just learned we're only supposed to bleed a tablespoon, and you're only supposed to bleed 2 to 3 days a week. Most of us are 7 to 10 days filling up pads and cups and tampons and leaking in the bed. So much so that they have created a diaper for cycles. They've created pads and panties and things that help you cope. Put that goddamn diaper on, get your ass out, go to work. It's money to be made. There's no downtime for it. A lot of times you have to fight and scrimple and to get the insurance companies to pay for the surgery. I've seen a lot of women have to raise funds to pay for the surgery. Then they need money while they're off of work. And that's even if you get approved for the surgery, because like I said, it takes 10 years, which means there's going to be like 4 or 5 doctors in there. So it's not a quick fix. Because for one thing, it didn't get bad like this until stage 3 and 4 overnight. So it's not going to be fixed in a day or two. I am really glad to see that there are more and more things being done to study it, to put in the work to figure it out, to hopefully cure it. And in my lifetime, that's one of the things that I'm working on to cure, because unfortunately, this shit is in the genes. So my grandmama's grandmama had it, which means my mama and my aunts, and then me and my cousins, and then our daughters could possibly suffer from this. So what do? Now that I know, I'm able to cut off some of the things that I know don't help. So when a girl starts her cycle, she gets about 14 to 15, she starts having terrible cycles. The first thing they do is say, we're here to take these birth controls. Now I'm like, no, we're not going to do that. We appreciate that. So it starts at home. But I didn't know that when I was going through it. So birth control, whether I was having sex or not, sure, let me take that birth control because it's going to help with my cycles. But not having a cycle isn't normal. That your body, our bodies are made to release that. And when you don't release it, guess what you do? You're pissing your body off even more. So I'm already far before. I know I lost a couple of you about 10 minutes ago. So I'm going to stop this, but I'm going to give you a part 2 and try to get into some of the things that you can do, maybe some of the steps that you can take to speed up that diagnostic period, so that you don't have to wait 10 years to be diagnosed, and that you can prepare yourself and go and research these doctors. And when you go in, you'll be that much more educated. Educate yourself, do your own research. And you got questions, comments, you don't agree, let's talk about it.